Hello and welcome to Simply Vita, a place where we have honest conversations about wellness, beauty, aging, and life in general, where we talk about how to live our best lives at any age. Oftentimes, we're being told that brain fog, weight gain, low energy, low libido, anxiety, lack of sleep, they're all just a natural part of the aging process. But what if they're not? Today, we're talking with Dr. Henry Sobo about peptides, hormones, and longevity, and what we can do to age better. Fine. So, hi, Dr. Sobo. I'm so happy that you're here. Thank you for coming on to Simply Vita. I feel like there's so many interesting things that we're going to dive into. But the first thing I wanted to ask you is what made you decide to follow a more integrative approach to medicine?
Well, first, thanks a lot for inviting me on. I really hope we have a great talk and are very informative for your listeners.
Good,
Well,
good.
I'm a doctor of internal medicine, and in my residency training, what we're really trained to do is diagnose disease of a person that comes before us with whatever condition they may have. And our job is to diagnose them and then treat them correctly. So, when I finished my residency training and I got out in what we're going to call the real world, it occurred to me as I saw things going on around me and what medicine offers people, there are some things that I felt kind of fell between the cracks. And it occurred to me because I started to get into nutrition. I actually had to lose some weight when I finished my residency training. And that led me to just having opening my eyes up to that there's a lot more out there than simply drug therapy. And the more I learned about that and I joined professional organizations or doctors who are more interested in holistic and integrative approaches. It just really opened my eyes and led me to feel that there's a lot more to be done than the more conservative, classical, I diagnose you, I give you the medication for the diagnosis. And, I have some examples of that, I was thinking about talking about, which we'll get to. But essentially, I just feel, I myself, I'm not into the idea of taking medication if I don't have to. And so I don't really want to prescribe for every single thing there is. There's just a lot more that can be done for people.
Well, I love that you had an open mind to follow this path because I agree with you, and I feel like not everybody has that. You go and you do all that work to get your medical degree, and then usually most people would follow just a more traditional path. But hopefully, more people are doing what you did and looking into an integrative path and just being open minded to it. I think it's a really great thing. So thank you for doing that.
Thank you.
Yeah, no problem. So there's so many things that I want to speak about. So I do have some points that I'm looking at because I just want to make sure we cover as much as possible because there's just so many things that I'm so crazy interested in
Right.
that you
Me too.
do. Yeah. So I feel like, and we touched on this a little bit that many people do feel dismissed when they say, I'm just not feeling right. I'm not feeling myself. Almost at like a certain age, doctors just expect you not to feel well. And, how do you feel about that? Like when somebody will come to you and say, I'm just not feeling great. I'm not feeling well. I'm super tired. My libido's low and all these things. But, they're just in their maybe like their early 50s or even like, mid 40s. Like how do you respond to them when they come to see you?
Well, a lot of this has to do with that there's something more to it than just a diagnosis of a disease. Sometimes when people ask me how I got into this type of medicine, I mentioned to them there are a couple of diagnoses that sort of got me here. And one was what people would call chronic fatigue syndrome. And so I think this is kind of interesting in this way. So how it's defined is if a person complains to a doctor that they're fatigued and it goes on for more than 6 months. So the definition is chronic fatigue syndrome is fatigue of no apparent cause going on for more than 6 months. So let's analyze what that means for no apparent cause. So let's say a doctor does all the blood tests that would cover a lot of the medical conditions with which a person would be fatigued. So you go to the doctor, you have this whole panel of blood tests. He checked, are you anemic? Well, that would make you tired. Do you have an underactive thyroid? Well, that would make you tired. Do you have liver disease, kidney disease? All these other things are checked. And then the doctor says to the person, listen to this phrase. The doctor says to the person, there's nothing wrong with you. Now, I don't know how many of our listeners may have ever come across that. And I want to give you an alternative interpretation. If all the tests are completely normal, I believe what really should be said is, the tests really don't uncover anything. Maybe we could figure something else out. And that's different than saying there's nothing wrong with you. That's in a sense saying to a person, well, it's really all in your head, things like that. There actually have been people and they're offered things like antidepressants, where the doctor says, well, you must be depressed. And the person doesn't feel they relate to that at all.
Mhm.
So there are things that may relate to subtle deficiencies which are not really diagnosable as a disease itself. And I know you were going to possibly bring up later on, we can talk about vitamin therapy, there's intravenous vitamin therapy, and that is something that could be used for people with chronic fatigue to energize their system. So we're not
Mm.
fixing a disease they have, but this underlying fatigue can still be a problem for a person, even if they don't have a diagnosable disease. And one
Mm.
thing I will mention, and it's also along the lines of fatigue, and I think this fits in with your question about when a person just doesn't feel that well. I'd like to talk about sort of optimization and hormones, and thyroid is a very important hormone. So here's an example I think people might be able to relate to. Maybe somebody has even come across this because thyroid problems are actually pretty common. It's not like it's a rare disease.
Mhm.
So I'll give you an example which I think really leads into like explaining an integrative approach and optimization. So let's just say, for example, a person who's tired recognizes that and other symptoms they have, like having constipation or not being able to lose weight despite having a good diet, or gaining weight and not feeling there's any real reason why they should be gaining weight, dry skin, certain amount of depression, brain fog. So a person with these symptoms might go to a doctor and actually say, and this has happened as for some patients who wound up coming to me, they would say, can you check my thyroid? Okay. So then I'm told that the doctor said your thyroid's normal. And that was the end of it. Now, there are some people in that situation who have come to me, and then I've actually put them on thyroid medication. So that leads to a very interesting question. Well, Dr. Sobo, why would you give somebody thyroid medication if the test said it was normal? Now,
Yeah,
I
why?
think I have a very good answer, and people will, I think, can really relate to this. And that has to do with what does normal mean in a blood test? And I'm sure that I don't know if your listeners are not familiar with this really basic fact about lab tests. The normal range in lab science accounts for about 95%. So let's let that sink in for a moment. If you get a thyroid blood test, you're compared to the rest of the population in what they call the normal range, right? People are used to looking at a lab report and you see your number, and on the other side of the page is the normal range. So from low to high in the normal range takes into account 95% of people. So
Mm.
let's just say you come to me in this situation, you're tired, you thought you had a thyroid problem, your doctor said it was normal. And then what if I say to you when I look at your blood test, well, you know what? Technically it is normal, but your thyroid's more underactive than maybe 85, even 90% of people. So then I say, I just said it was normal, but
Hmm.
that doesn't sound too good, does it? And everybody shakes their head and said, yeah, that doesn't sound too good.
Yeah.
So rather than saying to a person, well, your tests are normal, we'll check you next year. That's a way of saying, well, when you're really bad, then
Yeah.
maybe I have to treat you.
Yeah.
So we would say, why wait a year?
Yeah.
So if a person has all the signs and the symptoms and they could benefit by being treated, why wait until they're even worse to treat them?
Yeah.
And that's a really interesting difference in the approach, really. If you get totally stuck on this normal range idea, then
Mhm.
what you don't have is the idea of optimizing their hormone level and their function. And that's what
Yeah.
I would be doing in that specific case I just described, optimizing their thyroid rather than at least let it be good enough that they're technically normal because they're not out of the 95% to be abnormal.
Yeah. It's like they're treating it like a one size fits all, and it's not. I mean, that's such a great point that you made, that it's being compared to 95% of the population, but where I'm not the same as everybody else. And just that I know that you had tested me for hormone, and, you had told me, you said it's normal, but it's a little tiny bit off. Maybe we'll, start treating you for that. And I thought, when just what you said, it makes a lot of sense. Just like we were speaking a little bit about yesterday, when a doctor will say, you're pre-diabetic, but we'll wait until it gets really bad to treat you. That's so crazy.
Oh my
It's
god, I
just,
can't believe you came up with that example because I actually meant to talk about that. That's an extremely important thing.
yeah.
But So again, it's optimizing a person's function. And oh, here's what I was going to say about the lab test again, because you were just commenting. I didn't want to interrupt you. I was trained years ago. They said, without telling you guys how old I am, basically going all the way back to the beginning of my training, they always taught us, don't treat the lab test, treat the person. Now, the
Mm,
lab test is important. But what you need to do is interpret the lab test along with the person in front of you, and that's how you do it correctly. So anyway, that's about the thyroid. Hemoglobin A1C, that's the test I want to talk about now. So we're jumping ahead a little bit, but I actually meant to bring
yeah.
this up. So you had just described a situation that made me kind of upset when I had dinner with an older friend of 20 years. And here's what I mean by that. So he was told he's pre-diabetic, and he mentioned his cholesterol. He seemed much more involved with that. And I kind of got upset with him. I was losing my cool a little bit in this restaurant, and then I see people looking at me talking to my friend. I was saying, "Oh my God, Dave! Like, you got to understand something. You're pre-diabetic. That's very important." So let's take a break a moment. I want to go back to the description of again the conventional approach and kind of what you just said. I meant to bring up. When a person, so if people are familiar with this test, it's called the hemoglobin A1C test. I think a lot of your listeners probably heard of this test,
Mm,
and a lot of them probably had it on a physical. So now, when a person's test becomes slightly abnormal and they go from the normal to the pre-diabetes range, indeed, a lot of doctors will say, well, there's really nothing to worry about it. We'll monitor it and, we'll treat you if we have to. So it's another example of where if you want to be proactive, you don't take that attitude in my mind because, and this is why I was getting upset with my friend and explaining to him, saying, God, no, you have to understand this is really important. You're
mm,
pre diabetic, and when nothing's done, people will generally slowly progress toward diabetes. There's no
mhm.
reason to wait around for that and get treated. Like your assignment now is to prevent that from happening to you.
Yeah.
And that's
Yep.
really why I was so assertive and talked to him that way, because it's a risk to a person's health to then progress forward in a condition and not really do anything about it till later. So
Yep.
when it comes to prediabetes and then diabetes, sometimes I say to patients, I want you to Google search complications of diabetes because I want to scare you straight. Because that's all you have to do. Look up
Yeah.
complications of diabetes. And,
Yep.
and there's a lot of bad things there. Diabetics have a higher rate of all kind of medical conditions and basically degeneration of their health over time.
Yep.
So rather than waiting around, to me, it's sort of like, you have a green light, a yellow light, and a red light.
Yeah.
So you don't want to stop, race through at the end of a yellow light. I mean, it's a
Y
little better to stop a little before that.
yeah.
So it's like now's the time when you're just a little bit pre-diabetic that you put the brakes on this whole thing
Yep.
and go back to being normal in your blood tests, which certainly could be accomplished.
That being said, I wanna ask you, if you had somebody's blood test come back pre-diabetic, what would you do to try to get them or to keep either reverse the pre-diabetes or to make sure they're doing
Right.
everything they can to that it doesn't turn into diabetes?
Right. So first of all, the commonest thing, of course, in our society, not everyone, but the commonest thing is that people who have prediabetes tend to be overweight. So here's where we have to look at this now as not just a cosmetic thing. You don't have to be obese. And you might feel like, well, if I'm 20 pounds overweight, that's not that big a deal. And maybe you could say, okay, it's not that big a deal. But if
Yeah.
you're pre-diabetic, it is a big deal.
Yeah.
So that person has to be told to try to really lose that 20 pounds or at least a good portion of it because they're pre-diabetic. They have more of a need to lose that weight than other people that don't have that condition. And now again, I guess I'm going to talk about optimization, something that I saw actually in looking up some things just really in preparation for the podcast with you. And it has to do with anti-aging medicine. So that's going to be, of course, another of our topics.
Yes.
And in some of the things in anti-aging medicine which result hopefully in getting more optimized values actually could relate to the hemoglobin A1C blood test. So let's just take the person who's, if anyone's familiar with the numbers, just to make it easy, 5'7", the higher you go, the more you're into diabetes. So 5 and 6 and below, 5.6 and below is normal, 5'7" is pre-diabetes, and till you get above 6, you're not diabetic. So, okay. Now, if a person is 5.6, they're just at the very highest number of what's considered normal. And doctors will never say anything to a person who's 5'6".
Mm.
But here's what I want people that I'm going to give an example of something I think most people already have maybe had been aware of: cardiologists and cholesterol. And so, what I mean to say is, a lot of people know that a lot of people are put on cholesterol medication who really aren't even particularly high in their cholesterol at all. Their doctor just really wants it to be low. So the cardiologist, is if a person has a history of heart disease, et cetera, or family history, they're not satisfied with their cholesterol being okay. They want it to be low. So
Mm,
let's go over to hemoglobin A1C and being pre-diabetic. Even though you're technically normal and you didn't quite go into pre-diabetes, lower than 5.6 is better. And I was going to discuss with you like measures of aging and what anti-aging actually is, and can you slow down your biological age? That's a term. There's the chronological age, how old you are,
mhm,
and there's your biological age, which is something that can really be estimated and tested for, like how old is your biology? And you'd like to be a
mhm.
little younger than your chronological age in many
Yeah,
cases. So
of
this
course.
tests hemoglobin A1C. If it's not just normal, but actually further down, it's actually one of the measures that gets put into these evaluations of your biological age. You're much better instead of 5.6 on the borderline. If you go down to 5.5, 5.4, 5.3, 5.2,
Yeah,
then you
yeah.
really have a healthy hemoglobin A1C, and that has to do with your blood sugar regulation. And so it's really better to be kind of far away from prediabetes instead of
Yeah,
even normal, but close to
yep,
prediabetes.
I
So that would
understand,
never get
and
mentioned in a conventional medical setting. If you're not up to 5.7, you're normal, and that's great, and that's it. But
yeah.
if you are a person who really wants to take control of your health, you'll try to lower that 5 to 6, 5.6 to even lower, the way the cardiologists want your cholesterol to be lower than just okay.
So, I mean, that makes a lot of sense, and also I think it might be eye-opening to a lot of people who, when they go to the doctor and it seems normal, they're like, "I don't have to do anything." But, I mean, it makes sense, like, the further away, that you're away from it, the further away you are to be towards it. So, I
Well, it's
mean,
true
that
because, again, there's these underlying physiological things in the body. I know you were gonna ask me also about, like, inflammation in the body and all that. I
yes.
mentioned, like, most of the pre-diabetics in our society are overweight, but not everyone. I mean, there are thin people who develop diabetes.
Yep.
So, eating low carb, and I tell people not severely. There are some overdone low carb programs out there, I feel, but if you basically avoid the bad carbs that's just way too high in the average American's diet, the junk
Mhm.
food, I say to people who come to me, you don't really need my advice about avoiding diet, donuts and candy and ice cream. I mean, you don't need me to tell you that. So
Yeah.
avoiding that as strictly as you can, but then the other, what I call the big four in the average person's diet: bread, pasta, rice, potatoes. Now, not to say that a person's never gonna eat those things, and I'm not gonna tell people to do that because they won't do it anyway.
Yeah.
But if you really recognize that you really eat a lot of bread and you really eat a lot of potatoes and pastas and rice, then that's too much for a lot of people.
Yeah.
Maybe some people have heard eating low carb is really recommended to people for their health, not just for like a diabetes or pre-diabetes condition.
Yeah.
And so I've discussed with people the whole reason for that. If you think about it, if you accept the idea that eating low carb is really better than the average American's diet, well, that's actually because it'll lower that hemoglobin A1C. And it's like a
Yeah.
biological marker of your blood sugar regulation. So sugar's just not that good for you. When
Yeah.
I studied this going way back, and if you really consider, now we're getting to really some real science, but think about the human body and how it developed over thousands of years. Sugar itself, I understand, like in the Middle Ages, it was like a condiment that only like wealthy people could afford, like
Yeah.
sugar. So
Mhm.
your body developing over the thousands of years, like it's not really natural for us to take in straight sugar.
Yeah.
So it's just not good for you, bottom line.
Yeah.
So, like I say, there are overdone programs that I don't recommend to people because if you tell them to be severe about carbohydrate restriction, they're not going to do it anyway. And it's not
Yeah.
necessary. But if you avoid too much of the bad stuff, to put it really simply,
Yeah.
that's pretty good. And that's one of the basic ways in which people should try to maintain their health. Not too many sweets. We
Yeah.
could talk about exercise, all the basic things. Things that people can do in anti-aging medicine don't have to come down to esoteric things and hormones and peptides we'll talk about and all that. But I want people
Mhm.
to feel reassured about that there's really some very, very simple things. One of the most, maybe the most proven anti-aging thing of all is exercise. So
Mhm.
that's a freebie. You don't have to spend money. You don't have to get something put in your body. It's
Yeah.
just, again, think about the way we developed over thousands of years. Before washing machines and before automobiles, I mean, a person had to do a lot of physical work just in their average day to survive in life. And that's
Mhm.
really how your body was built. Being sedentary is very bad for people.
Very bad.
So
It's
exercise is the real
you bring that
basic.
up.
If you want to stay healthy, exercise.
Exercise. You bring that up, and literally before our podcast, I was outside and I have an 80-year-old neighbor. She's amazing, but she was lugging everybody's garbage cans into their driveway and she was moving so fast. And I told her, I said, Miss Francis, when I want to be you when I grow up. And she said, if you want to be me, you just never stop moving. She said, never ever stop moving. And she said that's her key. She said she's always, always moving. And, that's makes me believe even more that exercise is a key to so many different things.
Yep,
I
there's a lot of common sense to that. Some people have these special, like, desks where they stand, if you're in an office, if you have office work and all that,
Yeah.
because being sedentary is known to be bad for you. So
Yep.
even if a person isn't devoted enough, or even time elements, work, childcare, all of those things, don't be sedentary. Do something to stand, walk. Moving the body is really essential. And if you just sit somewhere for hours a day and you're not moving, it's just very bad for you. So even
So
if
bad.
you're doing desk work, it's true. Something as simple as standing up, trying to get a little bit of activity in your body
Yeah.
actually makes a difference statistically to then if you really just sat there.
Yeah. No, it makes so much sense. So basically, we know that as we've discussed, inflammation is linked to chronic illness. Yes.
Right. So inflammation is really important. And now I guess we could talk about another marker. And I'll give you another simple one too. Before we get into the esoterics of things people could do and what could be done about inflammation, many people may have heard of the Mediterranean diet. And
Mhm.
it's also called like an anti-inflammatory diet. So underlying inflammation is indeed an underlying cause of disease of all types. So you want to have like an anti-inflammatory lifestyle. And part of
Mm.
that, of course, is the diet. So, without getting into terribly much detail, it really is fairly basic. Like this Mediterranean diet, this anti inflammatory diet they talk about, lots of fruits and vegetables, because there's antioxidants with that.
Mhm.
There's the absence of too much refined sugar, because that's inflammatory to the body. So,
Mhm.
nuts, seeds, healthy oils like olive oil, more fruits and veggies than the starches I mentioned, the potatoes, rice, breads with your food,
Mhm.
healthy proteins, that's anti-inflammatory.
Yep.
If you eat well and you exercise well, again, to give our listeners something then other than, well, you have to see an integrative doctor. You know,
Yeah.
exercising and eating well accounts for more than anything else in anti-aging medicine, although I can still hopefully help a person who does those things fairly well with
Yes.
hormone optimization and things like that. But the basics really are in a person's control. If you eat well, and that was great what you said about your neighbor taking out the garbage can and her saying,
Yeah.
always move 'em around if you want to be like me. The
Yes.
basics are really there. And I think that another thing that was a concept I think we talked about, like, can you supplement your way out of a poor lifestyle or poor diet? And the answer is
Mhm.
no. You can't take 20 bottles of supplements a day and think that that's going to make you healthy. I'm not
Yeah.
against supplements. I recommend them all the time. But you
Yes.
can't add, you can't eat a bag of, Cheetos and French fries and have
Yeah.
a really poor lifestyle and be sedentary and take supplements and think that that's going to solve that.
Yes. Or you can't outrun a bad diet, and
Right.
I've
You
tried.
can't exercise off a bad diet either. Right.
Yeah, exactly. So, I wanna know, do you want to go on to our segment about hormones and hormone optimization? Because
Yeah,
that is
I
something.
guess this really is a good segue into that whole area. Because again,
Yeah.
it really is the difference between conventionally and conservatively only treating disease versus now we talk about aging, and part of that is having optimal hormone levels. And I know, we had talked about this idea of what they call bioidentical hormones in their use.
Mhm.
So, there's men and women and be a little different, although both of them have this kind of issue. But let me talk a little bit about that. First of all, what are bioidentical hormones? They've gotten a little old-fashioned, I think, but a couple of very common prescriptions that gynecologists have used over the years. One's called Premarin and one's called Provera, and they're similar to progesterone and estrogen, but they're not. So what we use when we optimize a person's hormone levels is actual estradiol or estriol, the actual estrogens that a woman makes, and that's instead of like a drug kind of a chemical that's kind of like your hormones. So again, gynecologists can give people these medications and help, let's say they're hot flashes as an example. But we think a healthier approach is you're giving a person not a synthesized substance, but when I give a person estrogen, it's the same thing their body's made all these years. It's just
Mhm.
now their level's kind of low. So it might be beneficial to them to replenish, not with a medication and looking at it that way, but we're replenishing the level of something normal to your body and
Mhm.
bringing the level back up because over the years you stop making this hormone efficiently. And
Mhm.
so everyone knows the term menopause. There's a term maybe people haven't heard of called andropause, and that's about
Mhm.
men going through the Middle Ages, where the same
Yep.
thing kind of happens to them, mostly related to the testosterone levels. This is
Mhm.
another good example of us talking about optimization. So a guy
Mhm.
comes to me, he's tired, he doesn't really have much of a libido, he's not strong like he used to be.
Mhm.
And if he goes to his doctor, first of all, the average doctor on their physical exam, they don't really check men's testosterone levels for the most part.
Yeah.
Some do, but most doctors won't even check unless the guy asks for it. But
Mhm.
here's the problem that even can come up when they ask for it. So here, let's take another really broad normal range. So a man has his testosterone level checked, and the range of normal is 250 to 1100. There's a big difference
Wow.
between
That's a big
250 and
range.
1100. So if a guy tests out at 350 or 400, he's normal.
Mhm.
That's the end of it. But in our type of practice, many men who have symptoms of what we call andropause, if they tell me all those symptoms, no libido for sure. Men's testosterone levels are quite sensitive to the libido issue. If they don't have a
Yes.
libido, if they're tired, they're feeling they're not strong anymore, and they have a level of 350 or 400, again, think about it for a moment. 250 up to 1100. Well, 350 to 400 is within that range, isn't it? But it's
Yeah.
not very good.
Nope.
So
It's
we're
not
really not
optimal.
disease per se, but relatively speaking, they are kind of testosterone deficient, and they will feel a lot better if they get that up to 5, 6, 7, 800, even 900.
Yep.
It's just pretty straightforward to see that.
And I think it's a shame because a lot of men, they may not go seek that treatment or they may not even ask to get tested for testosterone. And if more people knew that, like sometimes I think, because I know I say this because I've heard it from people that I know that hormones are for women. They're not for
Right,
men,
right.
but so
Let
not
me say a
true.
little bit about the whole safety of giving people hormones, because there is a certain amount of fear around people taking hormones, right? You've probably heard that from some women,
I
Angela,
was
right?
just going to ask you about it.
Yeah, a lot
Yes.
of people are afraid of hormones. So here's a couple things to be said about that. Now, one reason I think for the fear is there was a study that came out, it's almost about 25 years ago, I think. And there was a suggestion that hormones might increase cancer risk. Now, I believe that this has not panned out because if it really was felt to still be that way, it would create a great limitation on gynecologists wanting to give people hormones. And it's not a limited thing. It's going on every single day throughout the country. So I believe this kind of cancer scare that occurred many years ago did not really pan out as a sufficient risk so that people shouldn't get hormones. So again, it's about optimizing, and we would try to do it with a natural hormone their body makes, and now you're not making much anymore. And you're
Hmm.
not really said to have a disease, but skin tone, libido, depression, brain fog, as they call it. All these things can really happen when a person's hormones are too low. So let's get back to fear when a person might say, if you want to play devil's advocate, a woman might say, well, natural. You say it's like natural hormones. Well, my great grandmother never took hormones. Now, I can't
Yeah.
argue that that's the most natural, right? Do nothing.
Yeah.
But,
Yeah.
in a sense, if you think about it, I think most people recognize their great-grandmothers, there was more of an aging factor, and, of course, then people didn't quite tend to live as long. So it's true, you
Yes.
don't have to take anything, but we feel that it's pretty well proven. Oh, and I'll say something about the safety of how it's done, that a person will feel better if they have levels that are a little better than really rock bottom. which is, of course, what
Mhm.
a woman has in terms of estrogen. When we look at the so-called normal ranges, I mean, if a woman's in menopause, she's going to have a very low estrogen level. There's just no
Yes.
doubt about that.
Yep.
So here, let's talk about the safety of it, and this would be monitoring. And again, with men, again, this testosterone level, the numbers, because sometimes there has been a fear. Let's say testosterone, you could get like heart trouble. That would be if a person got treated excessively, or these gym rats doing testosterone, or if God knows where they get it from, without a doctor. If you have excessively high levels, indeed, that could cause trouble. But when a doctor who knows what he's doing treats you with testosterone, then you're going to come back for a blood test in 3 months or so. And what we see on the blood test, as I described to people, is we're going to see one of three things. Your testosterone level now is great. And I say, okay, we have you on the regimen you should be on. If the level overshot a bit and now it's kind of high, so then I lower your dose.
Right.
If the testosterone level is still kind of a little low, then I raise your dose. So the
Yep.
point is that you are being
I
given
think
a level
I
that's
don't
like
know
a
if I'm
healthy level and avoiding an excessive level.
yep.
And
I
then,
feel like
the side effects that women get, excuse me, women can get some side effects if the hormone level's too high. And it's the
mhm.
same kind of thing. We raise it if it seems to be a little low. We lower it if it seems to be a little high. So proper monitoring of it, and people feel better. And I think there's a great safety record for it.
So question, what would be the symptoms if a woman's hormones were too high after being treated? What do you think that they would come in and
You know, that's interesting. I would say, sometimes people will get skin issues, and I guess I would say there it's more the development of there might be concern of some medical problems that could occur if they're running excessively high levels. And let's say testosterone, which by the way, like you mentioned, is thought of as the woman's hormone. I mean, men's hormone. Women can be given testosterone also. So there,
Yes.
you don't want hair growth and you don't want a beard. So we
Yeah.
have to make sure that if we do give women testosterone, it's just at a level that their level should be at. You shouldn't have a testosterone level I should have. That's for sure.
Yeah.
But
That's
you could
true.
have a better testosterone level than you might naturally have when it runs really low, and libido also for women. I mean, when they don't have a libido, often it's because their testosterone level is nowhere.
Yeah. I mean, yeah, that makes a lot of sense. Was wondering, as people now, this is what I'm finding. It wasn't spoken about, back in the day. I know that me personally, it took me around 2 years because I was very afraid of the hormone replacement, and I actually read about you in a book. That's how I ended up seeking you out in
Right,
you were referenced in the Suzanne Sommer book that I
right.
had read because I was preparing for menopause. I just wanted to be, like, super prepared for it, but I have to say that it changed my life once you put me on the bioidentical hormones. That being said, I know it's a very personal decision for people to do. Some people are convinced that, there could be negative health benefits, to it, but sometimes I feel like we are living so much longer. And back to your point that you said about maybe our grandmother wasn't living as long. Because we're living longer, it just made sense. To me, it makes sense that you would have hormones longer. Because if say we're living to like 80, 85 now, that's a lot of years without hormones. And I read that hormones can protect your heart and it can give a woman some sort of heart protection.
I think
Do you
that's
agree?
pretty well considered to be shown statistically. I think that's really very true.
Yeah.
And other thing about it is trying it. If a person's concerned about it, you're not necessarily committed to a lifetime of hormone therapy. If you're kind of concerned about it, you could
You
try it and see if
froze.
you feel better, and that might help you make the decision. You could stop hormones if you feel you are not so convinced yet you want to take them, or you didn't feel it made you feel any differently. But for a lot of women, it's very good as just a trial if they're not so sure. If they have these subtle type of things that we've discussed, fatigue, little brain fog, no, not much libido. And they can just see if they do feel better with it, and they can really make their decision long term. They don't have to feel like, okay, that's it forever. I'm on hormones now, and they're really kind of fearful of that. They could see how they feel after doing it for 3 or 4 months and say, "Wow, that's great," or versus, "Well, I don't know." Then it's again, of course, it's a personal decision.
Yes. So now we covered hormones a little bit, and I'm glad that we did because I think that women should have that option. I know from firsthand experience that a lot of traditional doctors will not give you hormones, you literally have to go in there sweating, saying that you're not sleeping at all. This is from my experience, plus also a lot of women that I know. The doctors won't give them hormone replacement. You have to be suffering so bad that they would then decide to give you, the patch or, the type of hormones
Right,
that a regular doctor would give you. But to your point, I think that optimization early is better than waiting till you're completely suffering and not sleeping and drenching your sheets. I think that that's
right,
personally what I feel, and I think more women should be allowed to make that decision without being shamed for it and not being, having that fear of that flawed study that was done so long ago. They still have that fear in their head, that something's gonna happen to them.
right.
I that's
Angela, I want to mention something about sleep. I'm sorry. I wanted to mention something about sleep because you brought that up about not sleeping well. And it reminds me of something I wrote in an article a number of years ago about when a woman might be fearful of going on hormones for a possible negative consequence. So let's say they just sort of have this feeling, well, hot flashes aren't that bad. I could deal with it. Now, if a person doesn't sleep well, the fact is that that itself is very bad for a person's health. So
Yep,
when we get into the whole idea of anti-aging medicine again and preventing disease and all that, if you sleep poorly for 10, 20 years, again, let's say the hot flashes are not that bad, you feel like you can handle it. On the other
yeah,
hand, you don't sleep well. Well, if you don't sleep well for 30 years, that's bad for you.
yep,
So instead of fearing hormones and not going on them and sleeping better, you're accepting years of poor sleep, and that's very bad for you.
yep,
So
and
you're
that
kind of
can
avoiding it of a fear of something that could happen,
yeah,
but you're accepting something that's bad for you, which is poor sleep chronically.
yes, and again, I'm just saying this out there, it's a very personal decision.
Yeah,
Hormones are I personally am a big advocate for them, and I always tell my friends, it's something that I feel like it's a really good thing to do for yourself. So I'm glad that we covered it, and I do believe in the bioidentical hormones, and, Dr. Sobo does them, so make an appointment with him. It has definitely changed my life and for the better, and now I can't imagine not having them. I don't ever wanna not have them, so to me, I'd rather feel better in this life that we're living now than to suffer through it. That's just my opinion. So, we covered hormones a little bit. I wanted to discuss peptides with you because I know peptides are the biggest buzzword now, and I'm so interested in learning more about them.
right.
Yeah, so tell me a little bit about peptides. What are they?
Okay. So peptides, they're really just a link of amino acids. Maybe people have heard that amino acids make up proteins. So the only difference between proteins and peptides are that a protein is a very long chain of amino acids, depending who's defining it, like 40 to 50 more or more amino acids linked together are a protein. And if it's a short chain, 10, 15, 20, it's a peptide. It's the only difference. Now, first of all, peptides are natural to the body. We actually have thousands of peptides that we naturally make. And one, for example, is insulin. The hormone insulin is a peptide. And those
Hmm.
GLP-1 medications are also peptides. So
Oh.
they're, of course, the most well-known peptides of all these days. We could talk a bit about that. But
Mhm.
of course, there are a lot of other peptides used for a lot of other reasons. And, they have a very good safety profile. And I guess I want to address this notion about peptides, where a person might say, oh, it's not proven and that sort of thing, and FDA approval. This is really very worthwhile to talk a little bit about FDA approval, because sometimes people just take this sort of have a feeling about it like, well, if it's not FDA approved or it's not a standard medication, they kind of doubt it and they just really are not all that interested in trying that kind of thing. To them, it's a safety thing. And they're just not gonna do it if it's not an approved medication. So
Mm.
the problem with that, unfortunately, is there's 2 things that will get something never to be approved, and the main reason is that if something can't be patented, and we'll take vitamin C as an example of that. If something can't be patented, then there's no drug company that will put in, if people haven't heard the number, to get FDA approval on a medication requires not only tens of millions of dollars, it could be as much as $100 million
Wow.
for it to get through the approval process.
Wow.
So if there isn't enough investment in it, something's not going to get approved. So I brought up vitamin C because of something I think was a pretty fascinating thing that came out about a year and a half ago. There was a study where intravenous vitamin C, high dose vitamin C, which is known to be very good for cancer patients. There was a study done at Conventional Medical Center in Iowa, medical school study, and they came out and showed that people taking intravenous vitamin C who had pancreatic cancer doubled their survival rate, doubled it. Now, it's a
Wow.
horrible disease, and they by no means could cure them, no way, but they doubled their survival rate, and I was really excited when I saw this study coming out of a conventional medical center about vitamin C. But the really unfortunate thing was, at the end of their report on their study, they actually said, unfortunately, this isn't really going to get funding and it's really not going to be able to be repeated and it's going to get in the way of progress. And this is what they themselves said after they produced the study, because again, they pointed out that nobody is going to make billions of dollars from vitamin C. So nobody's basically going to ever do the size and scope of research necessary to get FDA approval for something like that. And yet there's lots of evidence. So when people say, well, there hasn't been studies, there's not evidence, there's a lot of evidence for a lot of holistic type of therapies. There's just not $100 million worth of evidence and a drug company behind getting an approval. And that's very often the difference. Sometimes there's studies of medications that are actually on the way, one that I use as a peptide, and it looked promising, but they just didn't get the investors enough, and they sort of gave up on it, the drug company. And that's really the only reason it's not approved probably, is they just didn't get far enough in the studies because they decided this is just gonna cost too much money, and they didn't get the investors for it, and that ended it even though the study seemed to look promising. And
That's
there's probably a
so
lot of examples
frustrating. Oh my
of that.
goodness, that's so frustrating, especially 'cause there are some people that you said that it won't cure pancreatic cancer, but some people just to get another year or 2 with their family is huge. That's a huge even 6 months longer is a huge thing.
And it's not just the longevity, by the way. When people get those kind of treatments who have cancer, they feel a lot better.
Yeah,
So it's really not just survival rate, but compared to feeling absolutely horrible the way that people do when they get chemo and all that. And of course, a person can do this kind of treatment even while they're seeing an oncologist and doing those things also, and they feel a lot better. So I think that's
my
just
god.
another thing about it. It's not only statistics of survival, but it does help how people feel who really have a condition like that.
So, because, I wouldn't think I'm not sure, but a conventional doctor is going to suggest, high amounts of vitamin C. What do you think is the best way to get that out to people who do have cancer? Like, are they mentioning that in
Well,
cancer treatment centers
unfortunately,
or
it's like I said, I was really excited when I saw this study was released by a conventional medical school and medical center.
Yeah,
So, I mean, we could talk for hours about
I
this kind of
know.
thing.
There's
But
so
frankly,
much.
I've been in this field for 30 years using intravenous vitamin C. And I will mention there are oncologists who do recommend it. There aren't many.
Yeah,
But
yeah,
what I felt about no names, but a doctor who had recommended somebody get that treatment from me. And I of course thought, well, why doesn't he do it in his office? I mean, he's an oncologist. And the
yeah,
really sad thing is about the change in medicine and insurance companies and all this kind of stuff, which basically came down to he was a part of this gigantic system, which most doctors are these days. Used to have more independent physicians. You'd go to their office. Now they're a part of this gigantic complex. So essentially, even though he's the oncologist, and in my feeling, being trained years ago, if this oncologist said, I want to give my patients intravenous vitamin C, well, why can't he?
yeah,
Well, it's because of this whole bureaucratic thing where he's in this whole medical system. So instead of doing it
yeah,
himself, he'll say, well, you could see this Dr. Sobo. But
yeah.
really, it's kind of absurd to me. If that doctor who's the specialist thinks that's right for his patients, why in the world wouldn't he be able to do it? And some bureaucratic thing is
Yep.
really the reason why he's not doing it.
It's just not part of their approved protocol. And
Right.
like you said, it's run like a business. They have meetings and, they have to like put things through and, it's like a sometimes I think it's like a baseline course of treatment that they're giving, like you said, like a one size fits all type of thing. And I feel that this is what I think. I think that either more the word has to get out more or people who are really sick, a lot of them are really seeking answers and they they start to get to a place that they start to get desperate, and then they start being more open-minded to these integrative type of treatments. I just
Right.
think it's a shame that a lot of people who are more traditional, they will poo-poo these types of things because they're, just so trained to believe whatever the doctor says.
And when you are
Hopefully
part
the
of a
younger
bureaucratic
generation is.
system, I'm sorry, when you are part
Yeah.
of a bureaucratic system, then stepping out of that system isn't very easy to do.
It's risky, right?
Yeah,
It's
yeah.
risky. Yeah. But I'm so glad that more and more people are seeking. I mean, obviously it goes hand in hand with conventional, treatment. I mean, I know that, like there have been incidences, Suzanne Summers being one of them that treated her breast cancer with deer antler, but then they found out later on she wasn't just doing deer antler, she was also doing chemo and, she was doing both. But
I
I
have
think
seen in my career, I think that's the best combination. And we tell people the IVs that I would give people, they're not going to cure them. And the best
yeah.
cases I have seen is when it's worked in conjunction. The people who did those treatments did better than the other people in that oncologist's office. And so both together, the chemo, of course, the reason it causes such terrible side effects is it's very toxic. So
Yeah.
what they've never found, and they're still researching to this day, they want the magic bullet of a chemo that will kill the cancer cells and leave alone the rest of your body. But
Yeah.
unfortunately, the way it is chemo will kill the cancer cells, but it's very toxic to every other cell in your body. So that would be
Yeah.
the ideal cancer treatment. They still haven't found that. Kill the cancer cells and leave all the healthy cells alone. So
Yeah.
if we have a person who's undergoing cancer treatment, then the other therapies that could be used, like the high dose vitamin C, is helping the rest of their 99.9% of the cells of their body while they're
Right.
getting all this toxic stuff put in their system.
Right. Like, don't deplete it to nothing before you're trying to put things back in. Do it together. Yes? Like,
Right. Right.
do it together. Yeah, that makes a lot of sense. So
You
let's,
mentioned, yeah,
yeah.
peptides. That and anti-inflammatory and preventive medicine. I did want to touch upon what's become such a gigantic thing in this country now, and it's the whole idea of those weight loss, diabetes type medicines called GLP-1s,
Yes.
because they've really have a lot of research now that because they're anti-inflammatory, there are other health benefits. So I did want to touch upon that because I've actually become a big believer in. I feel they're actually one of the greatest medical advances since I've been a doctor. And that's because not just the weight loss part, which is important for many people, but they've actually shown that they're anti-inflammatory to the body. And if they're anti-inflammatory to the body, that underlies the reason why statistics have now been developed that show, and when I show people the list of possible health benefits, I say some are proven, some are not yet proven. Heart disease prevention is really considered proven already. Cardiologists
Mm.
absolutely feel that GLP-1s are preventative to heart disease.
Wow.
The next one on the list is cancer prevention. And I tell people this hasn't been proven yet, but I believe it's on its way to being proven. It's anti inflammatory, and there seem to be showing things that show that people with cancer actually do better with GLP-1s. I'll tell you about a very interesting thing as it relates to oncologists and what oncologists think about GLP-1s. Here's what I mean. Maybe some of your listeners kind of know that oncologists traditionally, when people who take supplements, when they wind up in an oncologist's office, the oncologists have generally always told people, I want you to stop taking what you're taking. You're going to get treatment from me. I don't want to take you to take supplements. They always were concerned like it could interfere with some kind of cancer treatment. Anyway,
Mhm.
nowadays, if a person is on a GLP-1 and they wind up in an oncologist's office and get a diagnosis of a cancer, oncologists these days tell people to keep taking their GLP-1.
Wow.
And I think that really proves oncologists really know that this is all coming to the fore. And
Wow.
it might even be, this is too early to say for sure, but it might even get into cancer treatment itself. And just
Wow.
as a reasoning where a person might even see the logic of it, even if the cancer doctors are not highly into nutrition, a lot of them do tell people to avoid sugars. Like
Mm.
sugar is bad for you if you have cancer, aside from it's bad
Oh,
for
yeah.
everybody else, but it's really bad for cancer. So a lot
Oh,
of
yeah.
oncologists will tell people to avoid that. And so again, these medications, these GLP-1s for weight loss, they actually start out as diabetes medicines, lowering that hemoglobin A1C, getting like your glucose level to be at a healthier lower level. And
Mhm.
that's probably one reason why it may indeed be very beneficial for cancer and cancer prevention.
Wow. I mean, that makes so much sense to me. I mean, now I feel like they're getting more and more mainstream GLP-1s, but who would you think wouldn't be a good candidate to take a GLP-1? I
Well,
know that sometimes thyroid patients are not candidates. Is that true?
well, that's sort of true, but not really. There's a little more of a scare about that than there needs to be. I was actually surprised that an endocrinologist referred somebody to me for GLP-1, and the person had a history of thyroid cancer. So I was actually pretty surprised, but here's exactly why that happened. Those commercials about the GLP-1s, and like all the drug commercials, they quickly tell you about all the things that could happen, and they tell you if you have had a history of medullary thyroid cancer, you can't take GLP-1s. Great.
Mhm.
Well, the most common, so medullary thyroid cancer is about 10% of thyroid cancers. The rest of the 90%, you can take a GLP-1. So that's why, as I say,
Mhm.
I was surprised. As a non-endocrinologist, I was pretty conservative about this whole thyroid issue when they came out. And then this endocrinologist actually sent somebody to me with a cancer history. And then I realized, yeah, really, they're only doing it because, as far as they're concerned, they did not have this specific thyroid cancer called medullary thyroid cancer. They had the other more common one, and they felt like, well, that's
Mm.
fine. That has nothing to do with it. You could take a GLP-1. So some people are
Yes.
conflating these things like if they have thyroid condition itself, that has nothing to do with this whole issue of not being able to take a GLP-1 because of this type of cancer in your history. Just because if you have an underactive thyroid, I mean, there's no problem with a GLP-1 for that. That's just kind of a misunderstood thing now, like a buzzword, like if you have a thyroid problem, you shouldn't do it. And that's really
Shouldn't
not
take
even
it.
true.
I
So
mean,
as
that's
I want to mention microdosing as one other thought. I want some of your listeners may have heard of this idea of what's called microdosing, because you were
what
asking
is
who
that?
might not be a good candidate. Well, there's certainly a lot of people who shouldn't take GLP-1s who, in terms of cutting their appetite, in terms of losing weight. I mean, even though we have an overweight society, not everybody needs to lose weight. So there's an idea called microdosing, and that means you're taking a very small amount and you could get health benefits from it without it being the strong amount that could cause side effects or make you lose weight, let's say. So I'm going to divert for just a moment to give people an example of microdosing that almost everyone knows about. And it's been around for 50 years plus. No one ever called it microdosing, but it is. And that's what this is. Have you heard of Angela? I bet you've heard of this. And I know a
What?
lot of your listeners have heard of this. That people are told to take a baby aspirin for heart disease and stroke prevention, right? You've heard of that.
Yes, of
Right?
course. Yes.
Okay, so listen to the numbers here. A baby aspirin. If a person's never heard the dose, a baby aspirin is 81 milligrams. Now, if you go get a standard aspirin tablet in the pharmacy, it's 325 milligrams. And if you want to take aspirin for a headache or joint pain, you take two aspirin. Okay, so if aspirin is 325 milligrams, you're supposed to take two. That's 650 milligrams. Okay,
Mhm.
so if the standard dose of aspirin is 650 milligrams, well, how in the world are you to take a tiny amount like 81 milligrams to help you prevent a stroke? It doesn't
Wow.
sound logical. Now, there is a reason, there's a good reason, and that is with a very small amount of aspirin circulating in your body, it has a very mild blood thinner effect. So that's why blood thinner
Ah.
prevents like strokes and clots. So this small amount of aspirin in your body, too little to do anything for a headache or have anything you'll feel, provides you this stroke prevention. So now let's pivot right back to GLP-1s. If you don't need to lose weight and you don't want to have the amount of a dose of GLP-1 that'll stop your appetite and all of that, if you take a very small amount of a GLP-1, then it still has this underlying anti-inflammatory effect. So I
Mhm.
actually have people who have contacted my office wanting to take GLP-1s who are very well read and educated people, and they say, I want to take it for my health. And that's
Yeah.
actually the reason. So we give them a small dose, which helps with the expense, by the way, because if you take a small
Yeah.
dose, you use it up very slowly, so it's not as expensive. This whole issue, of course, of the GLP-1s and insurance coverage and those kind of problems. So if a person takes a small amount, they can get health benefits from it, and they're taking a small enough amount that it doesn't get in the way of their appetite and all of that. So I really
Mm,
believe they're an incredible medical advance. It doesn't mean it's for everyone, but
yeah.
I believe it's really an incredible thing the way it's all panning out and all the statistics that seem to be developing. I'm going to mention dementia prevention. I don't mind saying, we didn't really have a chance to get into that part of it, but in terms of preventive medicine, things that could be done to maybe stave off the development of dementia and all of that, it's possible. It does look like there's some evidence that GLP-1s might be preventative to that as well. So
Yeah.
cancer preventative, dementia preventative, heart disease preventative. I mean, what else does that? That's why I'm
So
starting to
many
believe they're an
things.
incredible medical advance, really.
Wow. You brought up the cost, and I think that, hopefully as things go on and more research is done, that it'll be more accessible to more people because unfortunately, it is expensive for some people but I think that it's probably a good investment in your health, if you want to like put aside, money to do that. But I do wish it was more accessible to more people because it is expensive. If it's not covered by insurance, it is expensive, but I've seen it do wonders for people. I've seen it change some people's lives. So, I hope more and more that the research that's coming out is just, more and more positive because I do think it has really helped a lot of people. So,
Yeah, I mean,
thank you.
hopefully there'll be more insurance coverage and all that. But the whole
Yeah.
idea of microdosing, just to mention that again to people, if you take a small dose, then
Yeah.
it's just a fraction of the expense of the person who needs the like really strong dose, and they use it up really quickly because they want it to
Yeah.
stop their appetite and they want to lose weight. And a very small dose stretches it out. That's one reason people got into this whole microdosing idea. They just
Yeah.
stretch out how long they have it for, and of course, then that makes it relatively inexpensive compared to what it otherwise is.
Yeah, I think, thank you for explaining that in that analogy with the baby aspirin because I wouldn't have even thought of it that way, or would I have known about the, microdosing benefits of the GLP-1s, which it really is a great way to be able to access them, but not, have that huge cost of having to go up and up, every month, So to that point, if you're taking a GLP-1, you lose a lot of weight and, you get healthy but then you wanna go off the GLP-1,
Right.
and then you gain all the weight back. Would you recommend always staying on a low dose to like a maintenance dose in order to
I
not
do,
get
although you don't
gain
have to,
back?
but this is really important too. I do want to address that. I'm glad you brought that up. First, I want to mention something about side effects and people losing muscle tone and all of that, because this is really important. Some of this because it is so well known now. And when people talk about some of the side effects, and as I've seen some people appear on different cable shows explaining this, some of these issues like losing skin tone and losing your muscle, they are not side effects of GLP-1s. They're not. They're side effects of rapid weight loss.
Yeah,
And so it's really important when it comes to using GLP-1s, there's a right way and a wrong way. And the analogy I give people here is like, let's just say, for example, a person takes a medication for high blood pressure, just to take any condition. So
yeah,
they take their pill once a day and that's it. They don't have to know anything. They don't really have to do anything. They just take their pill every day. So
yeah,
then I say to a person, well, on GLP-1s, there's a right and a wrong way. And so if you get a prescription and you don't think anything of it, you just take it. And that's how doctors prescribe it. They hear that, oh, that person will lose weight. That's it. They prescribe it. Losing weight is not like taking a pill every day.
yeah,
So they really should be really properly advised as how to do it. And
yeah,
just to cut right to it, a very healthy diet and a lot of protein in their diet is very important and preventative to things like losing muscle. They should exercise. And what people shouldn't do, because I talk about right way, wrong way, when people use it, and even doctors prescribe it, as simply it's going to stop your appetite and you're going to lose weight.
mm,
Well, if a person eats in an unhealthy way, well, then their appetite is less and they eat a third of what they're used to. And if you eat a third of what you're used to and you had a poor, nutritionally deficient diet beforehand, that's
mm,
actually pretty bad because now
yeah,
you're even worse off in a sense. So, the
yeah,
optimal way to use a GLP-1 is, let's say, as an example, for the person that has in their mind, I've heard many people say, who want to lose weight, well, I know what I should eat, but I really can't stick to it. That's a very
yeah,
common thing, of course. They just kind of can't have the willpower, let's say, to stick to it. So with a GLP-1, you should eat the super healthy, perfect diet that you actually know how to do. But now
mhm,
with the GLP-1, you'll do it. and not use a GLP-1 the wrong way is like, and I'll ask people about that TV show Survivor. I say to people, "You've heard of that TV show, right?" And everybody says, "Yeah, that's the one where you're like on a desert island and you're kind of starving, that reality show."
Yeah.
So I say, "Well, everyone loses weight, right? Everyone loses weight on this show Survivor, but that's
Yeah.
a bad way to lose weight, be starving on a desert
Yeah.
island." So you don't
Yeah.
take a GLP-1 to stop you from eating, so you eat practically nothing. And of course, you're gonna lose weight, but if it's not done right, if you don't eat well, exercise, then it's not really the very healthiest thing to do. So again, in terms of regaining, because that's coming out too. I just saw a study where they said 60% of people off GLP-1s, even with the expense or the difficulties of it, they wind up going back to it. So a
Mm.
good way to prevent that, and it does help with the expenses, it's true that when you've kind of gotten where you want to be weight-wise, or even if you're getting close and it's very expensive, if you microdose, then it stretches it out and it actually becomes at least relatively inexpensive, not very inexpensive, but it's
Yeah.
not the expense issue if you use a third of what people who have to, use it for weight loss. And if you're using a third of what they're using, in essence, the price is, let's say, a third per month of what you otherwise might have to spend on it. And it is
That
very
makes
healthy. At the beginning of this, people would always ask me, well, this is healthy. Can you stay on this? And the great news is it's like the opposite. It seems to actually be good for you. So I think,
yeah.
I've had some educated people come and want to do that. I don't mind telling you, I kind of tend to do that. You microdose when you don't need to lose weight and you don't feel the
Yeah.
effects, you don't get any side effects, and you might feel in a very subtle way you have that tendency, toward overeating or having difficulty with your weight. You don't have to take the really strong dose you might have to take when you're losing weight to just kind of stay where you are.
Yeah, good. That's good to know. And I agree with you. I think that it's not a magic bullet, right? You have to like learn those eating habits because if it stops and you go right back to what you were doing, then, it of course you're going to gain weight back.
Right.
Like
The
it's,
right way
you know,
is to do it in a very healthy kind of diet, both for not having side effects or any kind of complications like muscle loss.
yeah.
And like I said, that educated person that would come to me and say, "Doc, I kind of know what I should eat. It's just hard to stick to it."
Yeah.
That's where the GLP-1s are great for them. You then eat this really super healthy diet because you actually
Yeah.
know what to do, and now it's easy
Yeah.
to do it. Because it is true, scientifically, they've proven it's like the whole thing about cravings and all of that. It's even used these days, maybe some of the listeners have heard of this, like even in alcoholism. If you think about it,
I have
craving
heard.
food, craving alcohol, it
Yeah.
stops the cravings. So
Yeah.
that's why even for people who have what they call food noise or morbid obesity, people are always thinking about food,
Yeah.
and that's where for some of these people, it really has been life-changing. They can hardly believe it that they're not thinking about food anymore.
Yeah, that food noise is real. That's not a like, a made up thing. It's a real thing. And I think that when you don't have the food noise, I feel like you can almost do more. You're just not you can do more because you're not constantly thinking about food. I feel like not everybody has disordered eating, but for the people who do, it can be really life-changing.
Most
So
people, it
that
really is life-changing. By the
yeah.
way, I did wanna offer, for your listeners, if they wanna get any information, I have lots of information where they could read up on all of this. A lot of this is on my website, and
Yeah.
just consider it, there's so much information out there because it's so widespread now. There's so much in terms of study that's being done that people could just look at.
Yeah, actually, I was hoping to in the show notes to put the links that you sent me. There's so much good information in those links about the peptides and the GLP-1s, and I was looking through the information that you sent me. I mean, it was just so many good things. But because I have a skincare company and I make natural skincare, I did see that there is a peptide that is actually good for your skin and your hair. It was
Right.
called
Yeah, that's
GHKU.
becoming pretty well
Yeah.
known out there. So there's no question about it. It could be used in a face cream, could be put in a foam for the scalp for hair loss, and then it's an injectable that we often use for a lot of anti-aging effects.
Wow, I mean, there's just so many peptides, the immune and anti-inflammatory peptides, the tissue repair and regenerative peptides. I mean, if somebody comes into you they're interested in peptides, would you just basically ask them what their main concern is and then target it? Because you had mentioned peptide stacking. What is peptide
Oh, I see.
stacking?
So first, I would say, of course, it is true that it's not a one-size-fits-all thing, and you evaluate a person. And of course, a big part of the initial visit when somebody comes in and an evaluation is, well, what issues do you feel you have?
Yeah.
Everything from, again, if they have aches, pains, actually injuries. We didn't get into talking about, like, an orthopedist will say to a person with knee arthritis and knee pain, well, when it gets to that point, you can have surgery.
Yeah.
So you'd say, well, we don't have to just live with it and do nothing until you need knee surgery. You actually could use peptides to do better with it. So it's,
Mhm.
of course, all individualized. There's a lot of different peptides for a lot of different purposes. And peptide stacking is the term that's becoming sort of more well known now. Basically, stacking is putting together two or more peptides at the same time. A lot of things are very compatible and can be used, at the same time. So a person who might use, a GLP-1 for weight loss might at the same time use a peptide that will help them with, generalized kind of aches and pains of their joints if they have arthritis, for example. That simple
Mm.
kind of thing. Or that GHKCU you mentioned, which has a lot of different good cosmetic kind of, anti-aging effects.
Are peptides given by injection or
For
are they
the most
pills?
part, there are some of them are available as oral things. I People do always ask me, well, which is better? And the truth is, I can't see something being actually more effective than an injection right into your system. But not
Mm.
everybody's up for that. So I will say there are
Yeah.
some examples of things that you could take in lozenges and all that. And luckily, I've been, continuing to use them in my practice because the people who get them do ask for them again and say it's been helpful. So you don't have to do injections.
There are other ways. Have
Right.
you ever heard of things like there's this collagen that I put in my coffee in the morning. It's I forgot what it's called, Vital Proteins. Do you think those store-bought collagen and peptide powders are effective?
Well, I frankly would say I'm a little skeptical. Certainly, amino acids and certain things, there are certain nutrients that could be helpful into production, your natural production and collagen and all that. But you
Mm.
can't ingest collagen and then actually it just make a lot of collagen in your body. I don't think
Mhm.
it's not quite that simple.
Yeah, that's what I heard. I
Right.
heard that it can
Right.
be a waste of time, but,
Right.
I'm doing it anyway. So let's see, I wanted to see if there was anything else that we wanted to cover. I know we covered a lot. I could talk to you, like, all day, but we were gonna talk about vitamin therapy. I know we touched on the vitamin C
Yeah.
therapy, but are there other vitamins that can be injected that can do,
Right.
I know I've heard of vitamin B shots. Do you
Well, I
do
meant at
other?
the very beginning of the talk, I was talking about this whole idea of what they call chronic fatigue syndrome. So being fatigued isn't a disease, and yet people who get regular injections where it would not just be the vitamin C, but the B vitamins, like people will use the term vitamin C IVs, and it's sort of a shorthand for a title of what that IV is. But really, when we give what we call vitamin C IVs, they always contain calcium, magnesium, B vitamins. They might have zinc in them. So
Uh,
all these things put together are a lot more effective for a lot of people with that kind of problem that you can't really duplicate by just taking oral vitamins, oral vitamin
hmm,
supplements. There's nothing like it really being injected right into your bloodstream right off the bat.
that makes sense. So would people come into the office, like, weekly for injections, or how is it accessible to people? Like,
Right.
what would they do?
Well, of course, even though I do telemedicine and I speak to people who can't come to my office and all of that, of
Yes.
course, this is one of the cases where I can only help people who can come. And even that's individualized. And there's a certain practical matter, in terms of scheduling, how far they are, the expense of it. So,
Yeah.
that's really a detail question. Can a person come weekly? Do they really need to do that? I have people that come, less often than that, and it's certainly helpful. Although when they want a
Mhm.
maximum effect and they have an issue they really want to deal with, weekly is a very, very common schedule they'll do for a while. Even twice a
That
week if they want to be aggressive and really get into it and they're close enough by and they can, take on the expense of that.
yeah,
Vitamin therapy is very individualized in terms of the dosing and how often, all of that.
right, and I'm sure, like, what you actually need, because not everybody's body needs the same amount
Right.
of vitamins, yeah.
So there's certainly
Um,
a variety of different like formulas that I might put together for people.
yeah, that's interesting, I would love to do that. So, speaking of you not being close to everybody, but I do know that I am in Tennessee and you still treat me. So,
So I
I
do
just
want it to
want
be known
everybody
we
to
do
know.
call telehealth these days, so I have a lot of
Yeah.
patients who've never actually been able to come to my office, and I tell them, "I could do everything else for you other than give you a physical examination or do anything that
Yes.
actually requires you to be here." But I do feel in terms of what I can advise people to do and take and give them all the details in terms of that, all that can be done over the phone, so we do that.
Yeah. And blood test for for hormones, yes?
Well,
Could be
certainly,
done.
people can go get
Yeah.
tested, and they send in their tests and all of that, and we
Yeah.
evaluate it and talk about it.
Yeah. Just to touch on that, just one more thing. What is the difference between a saliva test and a blood test when you're trying to figure out what hormone treatment you
Okay.
need?
All right. Well, now you had to give me a really controversial one to end off on. Essentially, though, I would say that, there are practitioners, and I've used some saliva tests as well. They are controversial as to whether they're the best or not. I really won't say it's the best way, but it may be a little more sensitive or specific in terms of levels than the blood tests. And I certainly have used both. So I don't tell
Okay.
people they have to do it one way or the other.
Okay. That's good to know. Let's see. You to see what else we're gonna go with. I just wanna make sure we catch everything. I mean, I think we really touched on a lot of things, but I do know that I wanted to ask you, if you were my doctor, what would be the best exercise for longevity?
Oh, I'm so glad you asked me that because I know I said early on in this talk, one of the greatest things you could do for yourself, one of the most proven things for longevity and health is exercising. Now, really to answer your question, I'm so glad you asked. There isn't like one superior exercise. So if you take the two types, cardiovascular versus strength or resistance training, the answer is you really should do both. Now, it doesn't
Mm,
mean you have to be a gym rat and be in the gym 6 days, if not 7 days a week. But
yeah.
something to enhance your muscle strength is really important. Before I mentioned there are these biological markers of biologic age. So a very simple test is something they call the grip test. And you take a device and basically they're measuring how strong your grip is. So something as
Hmm.
simple as that is associated with longevity. If you kind of have a
Wow.
stronger grip, and that's an implication about the strength of your muscles. And so having a little, maintaining your muscles being stronger for longer is really very beneficial. And then the cardiovascular thing, again, related to your circulation, your heart, all of that. So they really
Yeah.
should be in combination, not like one superior workout or one superior exercise, but a workout that really does include, or at least one, one time resistance training, one time cardiovascular. Just do both. That's the basic advice. There's no one miracle exercise, but if you do both resistance training and you cardiovascular training, you're doing a lot for your health.
That's so good to know, and I yeah, that makes a lot of sense, and I know that the strength training is definitely important because some people like myself just like to do cardio, and I know that lifting weights is important, especially at
Yeah,
a
and you don't
certain
have to lift
age.
heavy weights and go into the Olympics and lift 500 pounds or something.
Yeah.
Just something very modest to just maintain your muscle tone. That's really enough.
Yeah, that makes sense. So if, let's see, what I wanted to else that I wanted to ask you. If someone made only 3 changes this year, what should they be?
Okay. Well, in a way, that's an easy question because I know two of the three immediately. I'm going to say basically, exercise is one,
Yeah.
and a healthy diet's two. I mean, much of preventive medicine is that stuff. And I guess if I throw in a third, we didn't talk at all about it, but stress reduction. Stress is a
Mm.
difficult thing. It wears on the body and the mind over time. So if you have the discipline to meditate or do other things for stress reduction, I think that's great too. If you exercise, you eat well, you get some stress reduction, good sleep, sleep's important, then
Yeah.
that's going to keep a person healthy.
Yeah, such great advice, all those 3 things, especially the stress reduction, which I think a lot of people have such a hard time with. But the sleep and the exercise can help with the stress, yes? So it can
Absolutely. Yeah.
all go hand in hand. Doctor Sobo, I can't thank you enough for taking time to come on to Simply Vita. Your information is invaluable, and I'm so happy that we were able to share it with everybody. Where can people get in touch with you? I know I'm going to be linking your Facebook, your Instagram, your YouTube. Also, you have YouTube videos out there
I
that are
mean,
super
yeah, I have some YouTube. And
informative.
then I do have a very easy to remember website, I think, which is basically drsobo.com, www.drsobo.com. I blog
Okay.
all the time. When the people go to the homepage, they go to the bottom of the homepage, they see the blog, they can keep scrolling to see all these many different blogs about all these health issues we've been talking about. And so I appreciate the opportunity to really be available to people, and they can always contact us right through the website or pick up the phone that's there. And we try to have my staff give people good explanations of what they might encounter in coming to see us.
Okay. Thank you so much, Dr. Sobo. You're amazing and you're doing great work and great research. And, I am really looking forward to trying to dive into some of those peptides. So, I'll be in touch with you soon. But everybody, if you can, go see Dr. Sobo. I just wanted to say that, just because we're aging does not mean that we don't, feel good. We can optimize our health. We can still feel great up, into our, very old age. People like Dr. Sobo are doing amazing things with peptides and hormones, and just take a look into it, because just know that, we age and that is inevitable, but that doesn't mean we can't age well. And there are so many things out there that we can get access to now that, our parents or grandparents didn't have. So, I was excited to present somebody like Dr. Sobo and, get in touch with him, go see him, have a conversation with him, and it'll be 100% worth it. I promise you. So, see you
Thank you
soon.
so much, Angela, for inviting
Thank
me. You're a
you.
great hostess, and it was such a pleasure.
Thanks.
I was afraid, I didn't know how we were going to fill up the time, and I see it all float along. I think it was a
I can
longer
talk to
process than
you
we even
for
thought would
hours.
happen.
Yeah. All
Thanks
right.
again.
Bye,
It
Dr.
was so great
Sobo.
to be